Okay, it's Bruce Williams again. I have a little bit of time off on Thursday afternoon, so I'm going to get a head start on Friday's Gross Path Challenge. This one is number 5, and the slides are from the 2004 Gross Path Review course, which was held on the grounds of the Armed Forces Institute of Pathology. Got a pen and a paper? Let's go. The first slide is tissue from a dog. I'd like you to give me a morphologic diagnosis, a pre-existing condition, and an associated hematologic or biochemical abnormality. Now, you can pause this for a minute or a minute and a half to answer these questions. I'm going to go ahead and give you the answer. I'm assuming that you've paused it on your own. The morphologic diagnosis is multifocal coronary arterial atherosclerosis. Look how thick and whitish yellow these arteries are, with a deposition of fat, which is oxidized, partially contained within macrophages, which gives it a yellow appearance. You can see this all over the body, but the coronary arteries are a very prominent site. These buildups usually start right before an artery branches, because you need a little bit of shear forces to get that fat into the wall of the vessel, and then it will progressively grow along the length of an artery. I asked for a pre-existing condition. Dogs may either have diabetes mellitus or hypothyroidism, the decreased activation of the enzyme lipoprotein lipase will result in high levels of circulating triglycerides. If you said hypertriglyceridemia and you were referring to breeds like the miniature Schnauzer, I'm going to give you full credit as well. Okay, name an associated clinical pathologic abnormality. We've already mentioned hypertriglyceridemia. Hypercholesterolemia would be one. Hypothyroxinemia, not so crazy about that one, but I've got to take it. And obviously, if you're thinking of diabetes mellitus, hyperglycemia would be an acceptable answer. Okay, you ready for number 2? Let's go. This is tissue from a mouse. I would like for you to give me the cause, and also give me another organ where you will find lesions. And don't say skin of the ears. And finally, name a strain of mouse that is resistant to this condition. Okay. The cause of this is murine pox virus, also known as ectromelia virus. The disease name is mousepox. Name another organ where you will find lesions. You can also see necrotic lesions in the spleen and the liver. Poxviral infections are system-wide infections. This is best demonstrated in a number of species like sheep with sheeppox, and goats, and mice, and unfortunately humans with smallpox, where the mortality rate is much higher than in other species. There are lots of pictures out there of the skin lesions of pox virus, but it's important to remember that you can have lesions in other organs as well. Okay, if you've been studying Percy and Barthold, you would know that a resistant strain for mousepox are C57 blacks. Okay, let's go to number 3. This is tissue from a duck. I would like the cause of this lesion, and give me a second lesion that you would find in this animal. Okay, time's up. The cause of this is annatid herpes virus type 1. If you told me duck herpes virus type 1, I'll take that as well. and it is a causative agent of duct viral enteritis. The lesion here, if you're not sure what you're looking at, is paraphymosis, or prolapse of the penis, and obviously this is a lesion that you'll only see in 50% of the affected birds at most. I asked you for another possible lesion. Well, knowing that it's duct viral enteritis, I hope you were thinking about necrosis in the gut. And it does have necrosis in the gut, and it follows a very particular pattern. Very early on, the herpes virus will attack the lymphoid patches, which are annular patches of lymphoid tissue, particularly prominent at the entry of the duodenum. So you'll have this circumferential Peyer's patch necrosis within the duodenum. Ultimately, it will result in a diffuse fibrinonecrotic enteritis affecting all the rest of the mucosa, and either of those would be accepted for full credit. Slide number 4 is tissue from an ox. How about a morphologic diagnosis, a cause, and name another site where you might find a similar lesion? Okay, pens down. The morphologic diagnosis is multifocal to coalescing, necrohemorrhagic rhabdomyocytis with emphysema for full credit. Rhabdomyocytis means skeletal muscle. And emphysema is very important. It's a very characteristic part of this lesion. You can see the little bubbles here in the muscle, and you have to have that in there for full credit. The cause of this lesion, the classic cause, the one that's in all the books, the one that you would expect, is Clostridium shovii. And the disease name obviously is blackleg. Now you can have pseudo-blackleg, which can be caused by a number of other organisms, also in the genus Clostridium, such as Clostridium sordelli or Clostridium septicum. But when you're asked for a classic question, you give a classic answer. So Clostridium shovii, the cause of blackleg, would be the one I would put down for full credit. And name another possible site. You can find this in the heart, especially the wall of the left ventricle, and the tongue near the base as well. Okay, I'm sure you're doing great. Let's go on to another question. This is tissue from a kitten. I would like you to name the disease. We'll just leave it at that. Let's just name the disease today. Okay, time's up. This one takes a little bit of thought. When I see a row of swollen areas on the ribs, one of the first things I'm going to think about are metabolic diseases such as rickets or vitamin C deficiency. Okay, unfortunately, it can't be either of those. Both of those generally affect the costochondral junction, for one, and that's where those lesions are usually seen. Second thing is cats can make their own vitamin C, so they're not going to get scurvy. And the third thing, if you look very carefully, on the left we have a normal rib plate. This is where all the lesion is, and you can see that we have nodular areas and multiple places along the rib, sometimes twice on the same rib. So this is a condition known as Osteogenesis Imperfecta. It arises from a genetic mutation affecting the formation of type 1 collagen. And these animals are not able to make good collagen, and they make it in very small amounts, so their bones break very easily. You can have multiple fractures occurring simply during the birth process, and that's why most of these cases that you'll see are in kittens, puppies, lambs, and very young animals. On to slide number 6. Tissue from a dog, and I would simply like a morphologic diagnosis. Okay, pencil down. The appropriate morphologic diagnosis is multifocal to coalescing cystic mucinous gallbladder hyperplasia. This is a very, very common lesion in older dogs. It's also seen in sheep, but not a lot of other species, interestingly enough. It may be one end of the spectrum where the other end is a gallbladder mucocele. The two lesions can look very similar, but of course the mucocele, these little areas of glandular hyperplasia, will extend much, much farther, and the entire mucosa will be covered and filled with inspissated bile. But you'll see this all the time if you post older dogs. Okay, let's move on. Question number 7. What a great picture. This is tissue from a rat. I would like a morphologic diagnosis. Name a type of rat that would get this lesion. And for fun, name another species that will develop a similar lesion. Okay, time's up. Morphologic diagnosis. Well, let's start with naming the disease, because that's the easy part. This is polyarteritis nodosa. Some people call it periarteritis nodosa, and that's fine too. Now, morphologic diagnosis is something you sort of have to noodle through here. And the one that I've carried around with me for 25 years, and I'm very happy if you would use that one as well, give it to you absolutely free of charge, is a multifocal coalescing, necrotizing, and proliferative mesenteric arteritis. Okay, so the location is mesenteric arteritis. The distribution is multifocal coalescing. And if you look at these histologically, you will see that there is extensive necrosis. The walls of these tortuous arterioles are infiltrated with large numbers of neutrophils. There is segmental stripping of the endothelium and extrusion of fibrin and other proteins into the intima and superficial media of these lesions, giving the classic lesion of fibrinoid necrosis. I don't particularly like the term fibrinoid necrosis, but that's where I get necrotizing. Proliferative is the fact that you have a combination of smooth muscle hyperplasia, which is in great disarray, and then in the outer media and the adventitia, you have tremendous numbers of fibroblasts which are secreting collagen. So it's both necrotizing and proliferative, and that's my morphologic diagnosis. I also asked you for another species that develops a similar lesion, and you can give me just about any species, because you can see this in just about any species. The ones that it is the best characterized in are the dog, in a condition known as Beagle pain syndrome, and in people, of which about 30% of cases are people who are infected with hepatitis C, and 70% are idiopathic. I also asked you for a strain of rat that gets this very commonly, and this is very commonly seen in the SHR, or spontaneous hypertensive rat, but you can see that in many inbred strains of rats. Question 8 is a dog, and I would like a morphologic diagnosis and a cause. Okay, morphologic diagnosis, we are looking at the ribs from the inside, and this is multifocal subpleural mineralization. It's just under the pleura, and the superficial part of the muscle is mineralized. And the cause, you could have gone one of two ways with this. If you said chronic renal failure, I'll give you full credit. A better answer is the result of chronic renal failure, and it is calcium phosphorus imbalance. Okay? This has nothing to do with high levels of circulating urea nitrogens that cause other lesions in these animals, but this is metastatic calcification. And in animals with chronic renal failure, if you take the calcium value and multiply it by the phosphorus value and it exceeds 70, you're going to start to get metastatic calcification or calcification of tissues around the body. And you'll see it in a number of places, including here, including the kidney, where you'll see mineralization of Bowman's membrane and tubular basement membranes. You will see it in the mid-zone of the gastric mucosa, and probably in the worst place you can have it, you will see it in the lungs, where you have mineralization of the basement membranes of the alveolar septa, and when that happens, that whole area of the lung is useless because you're not going to pass any oxygen across a bunch of mineral. Okay, we're getting down to the last couple of questions. Hope that you're doing well on the test. Let's see what we have. Oh, this is a classic. It is tissue from an ox. I would like a morphologic diagnosis, an etiologic diagnosis, and a cause. Okay, that's a classic question for a classic lesion. We're looking at a section of liver from an ox, and you have these very well demarcated areas of coagulative necrosis, which are blanched. They are totally devoid of color. They are devoid of blood going into them, and all the hepatocytes have undergone coagulative necrosis. Okay, you may have a dark ring of hemorrhage around them, and neutrophils trying to get in to clear it up, but it's a long process because they can't go through the vessels into there. They have to crawl in from the edges. And this is multifocal to coalescing necrotizing hepatitis. If you said hepatic necrosis, I'll take that too, for full credit. The etiologic diagnosis is hepatic fusobacteriosis or fusobacterial hepatitis, and the cause is Fusobacterium necrophorum, a classic commensal of the rumen, which in cases of ruminal acidosis and devitalization of the ruminal mucosa may get access to the portal circulation and cause abscesses primarily in the liver, but you can find them in a number of other places. Remember, Fusobacterium also is a commensal of the upper aerodigestive tract. I like that term, but probably easier to understand if I simply say the oral cavity, where it will get access through devitalized mucosa and cause a necrotizing lesion in the mouth called necro. And you can also see it in the respiratory tract, where it may infect the larynx and is a common cause of necrotizing laryngitis. Okay, we have one more image. This is tissue from a pig. I would like you to name the disease and give me the cause. Okay, this is probably from a grower finisher pig, maybe between 4 and 8 months of age. And the thing that you should pick up, we're looking at the cranioventral lung here, and there is a very distinct line of demarcation. The lung behind it looks pretty good, and everything in front of this is collapsed, atelectatic, and probably consolidated by inflammation. Now, if you do a lot of pigs today, you realize that there are very few pure viral or bacterial diseases. Most of the porcine respiratory disease complex cases we see have multiple viruses that you can isolate and multiple bacteria. But this is a very characteristic lesion of a disease which is known as Enzootic Pneumonia, also known as thumps. And the cause of this is Mycoplasma pneumoniae. It is a classic bronchopneumonia. Mycoplasmas want nothing more out of life than to be cilia, so you'll always find them in areas with cilia, and those are the airways. And the lesion progression after colonization of the cilia by mycoplasma is an influx of neutrophils. When you get enough neutrophils in there, they will coalesce, they will form pus, they will release their hydrolytic enzymes and dissolve the elastin of the airways. So the airways cannot contract. The mycoplasma themselves cause ciliostasis, ultimately loss of cilia, and then they become filled with exudate. Mycoplasmas also have superantigens, which cause profound hyperplasia of the bronchiolar associated lymphoid tissue. So those airways between the pus and the bald hyperplasia just look terrible histologically. Okay, well, I hope you did well, and we'll see you next Friday for another Gross Path Challenge. Have a great weekend.